everyone. I hope you can hear me well. Thank you very much for having me here as part of the series. I will now run you through some of the key findings from this synthesis review on training for behavior change. So as we know, training is commonly used within interventions to work within communities to change behaviors and shift social norms. It's a frequently used tool. It is a common activity that is present in some form or the other in nearly every intervention. So this synthesis review sought to capture the experiences and reflections of practitioners and their knowledge on training. Many of the decisions that are taken by civil society organizations on how they utilize training are based on their years of experience in the sector and their knowledge of what really works on the ground in their specific contexts. Therefore, the rollout of every training is very dynamic. It's dependent on the community and is constantly evolving, owing to the quote unquote living, breathing nature of working in this space. Next slide. So as part of the synthesis review, 7 CSOs and 10 projects were included. These projects are geographically diverse and include interventions from Africa, Asia, Europe, Latin and South America, and the Middle East. The CSOs and their interventions that were included are Breakthrough Trust in India, GGM in Guatemala, the Community Media Center from the State of Palestine, ACEV, or the Mother and Child Foundation in Turkey, Physicians for Human Rights from DRC and Kenya, Raising Voices in Uganda, and ECPAT from Madagascar. And every grantee used training differently in their intervention, from training women journalists and media graduates on gender and human rights, youth activists on media and gender, to working with girls and young adults in schools, to training social workers on protocols in cases involving child sexual exploitation, to training clinicians, police officers, and legal professionals, to working with community mobilizers, and finally, working with fathers to make domestic relationships more gender equal and to address questions of masculinity. Next slide. So this review was based on a framework identified by the UN Women Training Center that identifies 5 categories of training that trace the process of behavior change along a trajectory of learning and unlearning, beginning with awareness raising and progressing to skills training that can unlock a certain sense of agency and short-term changes in behavior that can then be amplified into shifts in societal norms. So therefore, this framework was designed to nudge participants to be self-critical as they unpack what gender and violence means to them, and then examine what kind of violence plays out around them in their society. And here on your screens, you can see a typology of this framework, and to it, we've mapped the interventions included in the synthesis review. And what you can really see is that all the interventions actually use a mix of the different types of training, from awareness raising and consciousness building, to not training for knowledge management or skills training, to attitude and behavior change training, and finally mobilization for social transformation. So while each training has a specific objective, most organizations use a mix to achieve their goals. Next slide. So moving to the key findings, there were 7 key findings that emerged as part of this study. The first finding that emerged was the importance of design in training. And really all grantees emphasize the importance of the design stage to ensure that project implementers are themselves trained prior to project implementation, because designing training thoughtfully takes time and resources. And in discussions with grantees and in the practice-based knowledge that emerged, there's a very clear emphasis on the importance of ensuring that the project implementers are themselves trained prior to project implementation, and that this pre-training requires significant work and planning. And essentially, CSO stated that this component needs to be built into program timelines, as otherwise they can be overlooked and discounted. So broadly, designing training requires a very deep understanding of how to adapt training to the local context. And one of the organizations in this who participated in this review was Raising Voices, and really this quote kind of explains very well how important training, the importance of design in training is. An alignment between practitioners, between trainers and participants is particularly important when innovative approaches are being introduced, especially in prevention work. Next slide. The second finding pertained to designing training to support learning and unlearning trajectories. One of the findings was that an individual's learning is never linear. And so therefore training programs should support individuals through this process. At a very personal level, many of the CSOs found that positive individual transformation could be achieved through training. And further, that because this is not a linear process, grantees also share that training needs to be designed to bridge the gap between a theoretical understanding and a contextually relevant training. So training must allow participants to engage critically with the subject matter and apply it to their lives. And what this meant was that the intention of the training should not be to transfer knowledge in a single session, but to incrementally work with participants so that the process is sequenced and iterative. Participants would learn, practice, experience, and build and reinforce their skills. And CSOs that were included in this synthesis review have had some success in designing these training formats that kind of wax and wane in intensity and allow for periods away during which participants could put their learning into practice. And this is particularly in the case of skills-based training, where you're training certain stakeholders on particular skills for the prevention of violence. A critical aspect of training design was also to create a training space that was inclusive and safe and did not replicate power structures that are very inherent in local contexts. Next slide. A third finding was on the importance of training tools and resources. Now, all training programs will invariably have some form of collateral or knowledge material that goes alongside the training. And indeed, all of the grantees that were included in this review produced some form of documentation or some form of supporting material. But their experience of many of the organizations has been that all of these assets, whether they're toolkits or manuals or lexicons, are really effective when they are not designed to be ancillary to the training or capacity building effort, but really that they are effective when they are placed at the heart of the intervention. For example, they have to be put together in collaboration with the stakeholders as well, contextually relevant and embedded at the heart of training sessions. There were also specific trainings on digital tools, and some CSOs trained their project implementers on using digital tools effectively. But one finding that came out, overall, there was a lack of training on measuring the impact of digital tools in preventing violence. This is specifically more for projects that do advocacy, and digital advocacy was an important part of their work. Next slide. A fourth key finding was the importance of networks and communities of practice that emerged. A common result of training programs are the network effects that they create. Because the shared physical experience of training becomes very valuable. It creates a space for co-learning and shared experiences. And some of the grantee organizations spoke about how some of these training spaces gave rise to a support network between participants. And one CSO found that there was great value in sort of networking sideways between other peers who were participating, whereas we tend to think of sort of networking upwards. Yet a challenge for many of these training interventions was that these spaces are temporary. Once the training is over, everyone breaks up and goes back to their daily jobs. And it's very hard to maintain the momentum of these spaces. And really a lesson that came out was that if these informal communities or practices can be nurtured, then participants can continue the process of learning and sharing their experiences beyond the training sessions. And these communities of practice can be very useful when it comes to sustaining the impact of training beyond the end of the training program itself. CSOs, typically use social media, messaging apps on a personal level, but the caveat there is that the individual becomes the unit and not necessarily the organizations. You create a network of people, not necessarily the organization. Next slide. A fifth key finding was the importance of training wider sets of stakeholders in the project ecosystem, because alongside training directed at primary stakeholders in each project, sensitizing secondary stakeholders was also important. Some of the training programs included in this review came from projects more focused on service delivery or tertiary prevention, but their experiences can also inform primary prevention training, particularly when training secondary stakeholders. One of the lessons that came out was that it was very important. CSOs realized it was very important to analyze who is to be trained um, based on the outcomes that the training hopes to achieve. For example, when you are identifying participants for training, it could be helpful to conduct a power analysis of different stakeholders to identify those who need to be trained beyond the primary participants because they can influence the outcomes of the intervention. So for example, several interventions in this review trained the media on gender sensitive reporting and considered them an important channel for prevention messaging. Um, CSOs also emphasize the need for greater cross-sector training because that could help bring together different sectoral teams who work on cases related to gender-based violence, leading to more trust and improved service delivery. Next slide. A sixth key finding pertained to the use of training for sustainability and to achieve scale. Uh, Grantees shared that when training is imparted effectively, the sustainability of the intervention truly rides on the shoulders of its participants. And a number of models have been used to ensure to sustain or sort of scale up the intervention, from training of trainer models or cascading models of trainers or training partner organizations on the core model of the intervention. These are commonly used tools, and often CSOs use a combination of training of trainers, refresher trainings, partner organization trainings. However, a common finding that emerged was that what's really important is to monitor and supervise the quality of the training so that it is both adaptive to the local context, whether it's geographical or cultural, but really there has to be continuous engagement to ensure that the adaptation and the training stays faithful to the core original methodology. So training of trainer models have to be closely monitored to ensure that there is this kind of fidelity to the core program. Yes, this is a great lesson from one of the CSOs that said that one of their values is really to be as agile and responsive while staying faithful to the original programming. Finally, a sixth lesson that emerged was with respect to training during COVID. I mean, COVID significantly affected prevention programming, in particular training of key tertiary prevention personnel was negatively affected. Physical training was made very, very difficult. So what we found that some organizations with resources were able to pivot to online training, and these had some advantages. They were at times more cost effective. They could reach a larger number of people, the quote unquote, get more people in a single space, so to speak. And this meant that more people who typically would have faced obstacles in physically attending sessions were able to, for example, women who may have faced limitations on their ability to travel. However, challenges still remained. Not all organizations had the resources to pivot online. And there still exists a very large digital divide. So there are still many significant issues of access, agency, and participation that still need to be considered when training in a COVID context. Nearly all the organizations spoke about the new dynamics that occur online. One of the big disadvantages of conducting online or remote training was that it was really hard to foster a sense of shared learning between participants because a lot of bonding happens, physically face to face. However, crises provide unexpected opportunities for new avenues of engagement. One organization was able to move its engagement online and created a new program for digital security for women because they identified that as a new space where women were vulnerable. Achev, which is the quote here, also found that their WhatsApp groups helped continue the local fatherhood initiatives quite organically as they evolved by themselves. Next slide. So finally, coming to some recommendations. The recommendations are quite broad and for practitioners, donors, and researchers. For practitioners, primarily, it is to invest in designing training that is participatory and fosters safe spaces where participants can reflect and learn, and design training that works with resources that are available in the local context. Training should also be at a pace that suits the participants. So whether it is, a longer engagement, perhaps, Organizations should also ensure regular refresher training, and a feedback loop is created between facilitators and trainers. Finally, nurturing and building networks that emerge from training. That's very important. That has come across as being quite useful. Next slide. In terms of recommendations for donors, they are broadly to support more investment in training. So that goes from supporting adequate budgets for designing and piloting training to supporting networks of partner organizations and communities of practice that emerge from training, but also funding documentation and lessons on training. I mean, as Adina said, that there's not a lot of literature on the how of training. Finally, as we all move online, donors should consider investing in bridging the digital divide, and also striking a balance between supporting training programs that emerge from established evidence-based methodologies to those that are more innovative. And finally, recommendations for researchers in the next slide. It's very fundamental issues that more research is required on the how and why of prevention training, really to understand the dynamics and what makes a training program truly transformative. And this synthesis review identifies some elements that can really help fill up a training program, but more research is required. We also need more metrics on online engagement and activities. Often training is imparted to do something, but partner organizations often don't know how to measure what they are doing. Finally, more research that supports the cross-fertilization of research and lessons, especially between primary and tertiary prevention, will be critical going forward. So thank you very much. Sort of raced through that, but I'll hand it over to Adina now.